Bismillahirrahmanirrahim. So you are studying about the Salmonella disease caused by the Salmonella. In the previous lecture, we have already discussed about the typhoid fever and the epidemiology and the some important features of the Salmonella genera. So in this lecture, we are going to study about the second disease caused by Salmonella, and this is known as the Enterocolitis. Enterocolitis, also known as the gastroenteritis. Gastroenteritis. So, what are the species of the Salmonella which cause the enterocolitis? So, mainly two species cause the enterocolitis. The first one is the Salmonella enteritis, and the second one is the Salmonella typhimurium. Salmonella typhimurium is the most common cause. It causes the enterocolitis much more than the gastroenteritis. These two species are mostly killed by the gastric acid. So, a lot of organisms are required to cause the enterocolitis. So, they have an infectious dose of about 100,000. 100,000 organisms are required to cause the enterocolitis or the gastroenteritis. Now, what is the pathogenesis? How do they cause the gastroenteritis? What is the pathogenesis? So, they mainly cause the gastroenteritis by causing inflammation in invading the mucosa and submucosa of the gastrointestinal tract. For example, this is the GI tract, this is the mucosa consisting of epithelium, and beneath this it is a submucosa. So what does they do? They invade the mucosa and submucosa by going through between the cells, and here they cause the inflammation, releasing cytokines and causing filtration of neutrophils, and thus they cause the enterocolitis. But the good point is that in this enterocolitis and this invasion mainly limited by the neutrophils. They mainly limit this invasion and inflammation, and thus they prevent the enterocolitis. So there are much more defenses against such kinds of species, and they prevent us or protect us from the enterocolitis caused by these two species. So now let's talk about the clinical findings. So after the incubation period of about 12 to 48 hours, there is appearance of signs and symptoms, and the clinical findings consisting of enterocolitis are nausea, vomiting, diarrhea, abdominal pain, and this diarrhea may be associated with the blood or may not be associated with the blood. No blood. It may be watery diarrhea or it may be dysentery, depending upon the extent of inflammation. So these are some clinical findings, and all of these are self-limited. They do not require any treatment. They are mostly self-limited. So this was the second disease caused by the Salmonella species. Now we will discuss about the third disease, and the third disease is known as septicemia. So what is the causative agent of septicemia? So they are mostly caused by the Salmonella coaleraceus. So it is the most common cause of septicemia caused by the Salmonella genera, and this septicemia occur, and this Salmonella coaleraceus cause septicemia mainly in the two conditions: in those people which have chronic disease chronic disease like the sickle cell, and those people and those children which have already enterocolitis. Enterocolitis. Those patients which have already a chronic disease like the sickle cell, and those patients which are already going through the enterocolitis, so they are much more susceptible to have a septicemia due to the Salmonella filariaceus. So how does they cause the septicemia? They enters the blood, simply enters the blood and attacks the organ. Every organ which the Salmonella filariaceus find, they attack it and causes disease in them. So what will be the clinical findings? The clinical finding will be related to many organs. For example, the first will be general feature. There will be fever, malaise, etc. And depending on the organ, there may be osteomyelitis, and it is mostly in the sickle cell. There will be pneumonia if it attacks the lung. Pneumonia. There will be meningitis. There will be metastatic abscesses, and this metastatic abscesses is much more common in those organs which are already infected. So they are much more common in the diseased organ, like in parks and aneurysm. And there can also be vascular graft infections. Vascular graft infections. So osteomyelitis due to bone, pneumonia due to lungs, meningitis due to the meninges, metastasis abscesses on the already diseased organ, and the most common organ involved are the infarcts and the aneurysms. Infarcts and aneurysm, and there can also be vascular graft infections. So these were the clinical findings of the septicemia caused by the Salmonella filariaceus. So now let's talk about the laboratory diagnosis of the Salmonella species. Laboratory diagnosis of the Salmonella species. Lab diagnosis. So the first one in the lab diagnosis is to look for the straight gram-negative rods, on the microscope. So the first one is to do the microscopy. In the microscope, we look for these straight gram-negative rods. So this is the first lab procedure which we do. The second one is to do the culture. In the culture, we mainly use the McConkey. First use the McConkey agar. In the McConkey agar, what we find? Change the color. We find colorless colonies. And these colorless colonies are due to the non-lactose fermentations of the Salmonella species. So there will be colorless colonies. We also do another agar test which is known as bismuth sulfide medium. And in bismuth sulfide medium, there will be formation of black colonies. And these black colonies are mainly due to the H2S production, because the Salmonella species all produce H2S, so they will form black colonies on this bismuth sulfide medium, and this is the characteristic of the Salmonella species. This is the characteristics of the Salmonella species. We can also culture the Salmonella on the TSI agar, triple sugar iron. And on triple sugar iron we will have an acid butt, i.e. there will be yellow, and the alkaline slant, i.e. it will be red. There will be acid butt and the alkaline slant. What is butt and slant? So in the test tube, this portion is known as slant, so it will be alkaline, and this portion, the lower portion, the bottom portion, will be, which is known as the butt, and this will be acidic and will appear yellow. And one important point regarding the Salmonella typhi is that there will be gas production in the TSI agar, and by all the species of the Salmonella. By all the species of the Salmonella, there will be gas production along with the H2S, except the Salmonella typhi, that it produce only the H2S, and there will be no gas production. So it is the characteristics of Salmonella. Serological test, these were the cultures. We can also do the serological tests. Serological test. In the serological test, we mainly do two kinds of test. The first one is the latex agglutination test. Latex agglutination test. And the second one is the Waddell test. And the first one, the latex agglutination test, is based on the procedure, or is based on the principle that we know the antibody. We know the antibodies against the Salmonella species, and we have to look for the antigen. So if we find antigen, then it is known that it is a Salmonella infection. And the Waddell test is based on the principle that we know the antigen, and we have to look for the antibody in the blood. So these were two serological tests, the latex agglutination test and the Waddell test, which we do for the Salmonella diagnosis. Now let's talk about the treatment. So we will go to disease wise. The first one is what? Enterocolitis. So what is the treatment? What will be the treatment of enterocolitis? So it is mainly self-limited. So we use only antibiotic in the old and the neonates and the chronic illness. We use only because there is a chance of what? There is a chance of having a septicemia. So it is mainly self-limited in the normal individual, and we use antibiotic only in what? In two kinds of situation, in those which are mainly old and the neonate, and those which have chronic disease like the sickle cell. We also do fluid and electrolyte. Now the second one and the most important one is the typhoid fever. So for typhoid fever, we mainly use the ciprofloxacin or ampicillin. And if someone is the chronic carrier of typhoid fever, then what we do? Then we give them these two drugs, the ciprofloxacin and the ampicillin, and we also perform a procedure known as cholecystectomy. In cholecystectomy, there is the removal of the gallbladder, because the carrier of the typhoid fever, the Salmonella typhi, they are mostly present in the gallbladder, and from the gallbladder they they are excreted through the intestine into the environment, and they cause the disease in other people. So we do the cholecystectomy, and we mainly give the ciprofloxacin and the ampicillin, which are the drug of choice. Now, how to prevent the disease? How to, how to prevent the disease caused by the salmonella? So the first one, obviously, it is the personal hygiene. Personal hygiene. And the second one is vaccination. So there are mainly two types of vaccination. The first one is mainly based on the virulence capsular polysaccharide, and it is mainly given intramuscularly. And the second one is mainly based on the live attenuated strain of Salmonella type, and this strain is of type 21A, and this kind of vaccine is mainly given orally. So vaccination and personal protection, personal hygiene can make us prevent the disease caused by the Salmonella species. So that's all for today. Thank you.